student.
Yes,
Check.
ma'am.
मैं join करी.
Ma'am, in Hindi or English, please
Okay.
speak because I don't know.
Okay. So new joining, Jayanti.
Yes, ma'am, last week.
Okay. Welcome, welcome.
Thank you, ma'am.
Actually, the subject is mental health nursing. We are continuing. In addictions is the name of the topic or chapter. And now in continuation, drug dependency we will start.
Okay, ma'am.
Okay. So alcohol use. Alcohol use disorders. Lastly, we have learned alcohol use disorder and alcohol withdrawal symptoms. Interventions. What we will take if alcohol withdrawal symptoms will be there in patient, and dealing with the client who has a substance use disorder. Drug dependency. An overdose of a drug can lead to a toxic condition and death. Now, drug overdose is so because of that, it may be leads to toxic condition or maybe death. If level of toxicity will be increased in blood, it may lead to death. CNS depressants include alcohol, benzodiazepines, and barbiturates and act as a depressant, sedative, or hypnotic. Now, CNS depressions, so depressions include alcohol, benzodiazepines, medication જે આપણે યુઝ કરીએ છીએ, then barbiturates. Also, medication જે છે યુઝ થાય છે CNS depressant તરીકે. Generally, aggression પેશન્ટ જે છે એન્ઝાયટી વાળું હશે, સો એન્જિયસ. હિન્દીમાં ટ્રાય કરવું સમજાવવાનું કેમ કે મારું ગુજરાતી નીકળી જશે એટલા માટે. સો ઇફ પેશન્ટ विल बी हैविंग एंजाइटी डिसऑर्डर और अग्रेशन, उन पेशेंट्स में हम बेंजोडाइजेपाइन्स बार्बिटूरेट यूज करते. जनरली वो सीएनएस डिप्रेशन करता है. सीएनएस सेंट्रल नर्वस सिस्टम जो होता है उसमें डिप्रेशन और वो जो उसका सिस्टम है उसे डिप्रेस करता है. सो जो भी प्रॉब्लम्स होंगी वो बिकॉज ऑफ सीएनएस डिप्रेशन और डिप्रेशन जैसे उसकी वजह से होगी. फॉर एग्जांपल, दे एक्ट एज अ डिप्रेशन, सेडेटिव और हिप्नोटिक. Intoxication and withdrawal. Intoxication will be there because of alcohol or benzodiazepine barbiturate, and withdrawal symptoms will be there if suddenly you stop taking drugs, alcohol or benzodiazepines. Withdrawal symptoms will be there. Overdose can produce cardiovascular or respiratory depression, coma, shock, seizures and death. So overdose can leads to cardiovascular depression or problems, respiratory depression, because central nervous system is also related to respiration or respiratory system. So respiratory system depression will be there, coma, shock, seizures, and death. Overdose. If overdose of CNS depression will occur, if the patient is awake, vomiting is induced and activated charcoal is administered. If patient takes overdose of medicines, for example, benzodiazepine or drugs, benzodiazepines, barbiturate or alcohol, if patient is awake, you have to induce vomiting by administering charcoal, activated charcoal, and then activated charcoal will be mixed with water or solution, then be administered in digestive system. So it will induce vomiting. If the client is comatose, establishment and maintenance of an airway and gastric lavage with activated charcoal are the priorities. Seizure precautions are indicated. And if client is comatose because of effect of overdose if client is in coma condition. ગેસ્ટ્રિક લવાશ ઓર એરવે મેન્ટેનન્સ જે છે એ કરવામાં આવશે, એસ્ટાબ્લિશ કરવામાં આવશે. ગેસ્ટ્રિક લવાશ will be done by using activated charcoal, and seizure precautions are initiated. Flumazenil intravenously may be used for benzodiazepines overdose to reverse the effects. Now, flumazenil IV will be used for benzodiazepine overdose. Benzodiazepine overdose generally diazepams and all medicines are used for benzodiazepine drug use. And overdose, if there will be overdose of benzodiazepines, to reverse the effect, use flumazenil intravenously. Withdrawal must be treated with a carefully titrated similar drug. Abrupt withdrawal can lead to death. Withdrawal must be treated carefully and titrated similar drug. Abrupt withdrawal can lead to death. Now, withdrawal symptoms, if you try to stop abruptly medication or drugs, it will it can lead to death because of abrupt withdrawal. So withdrawal must be done gradually and treated with similar titrated drug. Withdrawal from CNS depression such as barbiturate is generally treated with barbiturate such as phenobarbital or a long-acting benzodiazepines. If CNS depression જે છે એનાથી withdrawal કરવું હોય, so withdrawal can be done by using barbiturates. For example, phenobarbital or long-acting benzodiazepines you can use for withdrawal. Similar drugs, as આગળ કહ્યું એ પ્રમાણે similar, you have to use similar drugs. Carefully using similar drugs can help you in withdrawal. So for withdrawal treatment, phenobarbital or long-acting benzodiazepines you can use. Central nervous system stimulants. Now, આગળ જે છે એ સેન્ટ્રલ નર્વસ સિસ્ટમ ડિપ્રેસન્ટ્સ હતું. Now central nervous system stimulants. Central nervous system stimulants include substances such as amphetamines, cocaine, and crack. Now, these substances can stimulate your central nervous system. So, whatever the function of central nervous system, it will be increased. Intoxication and withdrawal. Intoxication and withdrawal can cause many symptoms. CNS depression, if intoxication occurs because of taking CNS depression, what are the symptoms you can see in intoxications? Drowsiness, hypotension, impairment of memory, attention, judgment, unsteady gait, irritability, slurred speech. Drowsiness will be there. Patient will feel drowsy or dizzy. Hypotension, blood pressure will be down, decrease. Impairment of memory, attention, and judgment. If intoxication will be there, so memory જે છે એ impaired થશે. Memory impairment જે છે present હશે. Attention span impaired થશે. Attention span જે છે એ ધીમે ધીમે એનો જે timing જે છે કે attention span જે છે એ for 45 minutes હોય, so એ જે છે ધીમે ધીમે decrease થતો થશે. Totally impaired attention span will be there. Judgment will be impaired. Unsteady gait, straight stand नहीं करी सके person જે છે, and they can't walk steadily. Steady gait will be there. Irritability and slurred speech. If CNS depression, withdrawal symptoms will be there. So what are the withdrawal symptoms for CNS depressions? CNS depressant drugs જે છે, first you started using them and abruptly you are trying to stop taking drugs, there will be withdrawal symptoms. Nausea and vomiting, tachycardia, typhoresis, anxiety and irritability, tremors, insomnia, and seizures. Nausea, vomiting, જે છે commonly present હશે. Then after tachycardia, heart rate will be increased. Typhoresis, excessive sweating જે છે patient ની અંદર present હશે. Anxiety and irritability, tremors. Patient will be anxious and irritable. and tremors will be there. Hand tremors you can see clearly. Insomnia, difficulty in sleeping, and seizures will be there. Now, CNS stimulants, intoxication. In intoxication, what are the symptoms? Dilated pupils will be dilated. Now, pupil size જે છે, generally જ્યારે central nervous system stimulant, whenever we are using, if intoxication occurs, they will dilate your pupils. So you can identify by examining pupils. Euphoria, excessive euphoria means a person will feel excessive happiness without any reason. Person will be in euphoric mood. Hypertension and tachycardia, blood pressure will be increased and heart rate will be increased. Impaired judgment, insomnia, paranoid delusions, hallucinations, agitation and cardiac dysrhythmias. पर्सन જે છે એ પેરાનોઇડ ફીલ કરશે, સો પેરાનોયા હશે. જેલસી ઓર એબનોર્મલ બિહેવિયર જે છે પ્રેઝન્ટ હશે પર્સન જે છે. And delusions, false belief. Delusions means ke false beliefs. Person will believe in some supernatural power. No, delusion of grandiosity, delusion of persecution, jealousy. So, and hallucination, maybe auditory hallucination present hoy, or tactile hallucination. જેટલા બી hallucination ના types છે એમાંથી કોઈ બી type નું hallucination will be there. Agitation, restlessness person જે છે feel કરશે, and cardiac dysrhythmias. If CNS stimulant જે છે એનું withdrawal હોય, abruptly તમે CNS stimulant લેવાના બંધ કરી દો, so એ વખતે withdrawal symptoms will be fatigue, vivid nightmares will be there. Insomnia, hypersomnia. Insomnia, difficulty in falling down sleep. And hypersomnia means કે person જે છે એ excessive sleeping ની અંદર જોવા મળે, બહુ long time સુધી જે છે એ ના sleeping hours હોય. Anxiety and agitation will be there. Depression and suicidal ideation in withdrawal symptoms of CNS stimulants. Overdose can produce respiratory distress, ataxia, hyperpyrexia, seizures, coma, stroke, myocardial infarction, and death. Now, overdose of CNS stimulant can produce respiratory distress, respiratory system problems will be there, difficulty in breathing, or respiratory system will be affected, difficulty in breathing may be there, or decrease breathing rate will be there. Ataxia means કે જે muscle movements છે એ properly નહીં થાય in patient. Hyperpyrexia will be there. Temperature જે છે increase થઈ જશે. Hyperpyrexia means કે temperature above 105 or more than 105. Seizures, coma, stroke, myocardial infarction, cardiac system will be affected, and maybe if overdose જે છે એની કોઈ treatment ના થાય, so it may lead to death. Overdose is treated with antipsychotics and management of associated effects. Treatment for overdoses, and you can use antipsychotic medications and management of associated effects જે છે એ બી તમે treatment provide કરી શકો છો. Withdrawal is treated with antidepressants, a dopamine agonist, or bromocriptine. Withdrawal is primarily supporting, particularly when dealing with the severe depression and suicidal ideation that accompanies stimulant withdrawal. Withdrawal symptoms જે આપણે આગળ જોયા, so withdrawal symptoms include depressions and suicidal ideation. So for treatment of withdrawal, antidepressants we can use, or dopamine agonist we can use, bromocriptine will be used. If withdrawal is primarily supportive, particularly when dealing with severe depression, if client is suffering from severe depression in withdrawal symptoms, if severe depression will be there, you can use antidepressant medication. In suicidal ideation જે છે એ બી જે છે withdrawal symptoms ની અંદર severe depression જે છે એની સાથે associated હશે, સો એટલા માટે antidepressant medication જે છે withdrawal ની અંદર યુઝ કરવામાં આવે છે. Now, next is opioid medication or opioids include substance such as opium, heroin, meperidine, morphine, codeine, sulfate, methadone, hydromorphone, oxycodone, hydrocodone, and fentanyl. Mostly, some are opioid medication and some are opioid drugs. For example, opium and heroin. Meperidine, morphine are common drugs we use in hospital area or hospital site. Hydromorphone also we can use, or oxycodone, hydrocodone, fentanyl. Now, intoxication and withdrawal. If opioid medication जैसे if एनो overdose થઈ જાય, so intoxication and withdrawal symptoms કયા કયા છે? For opioid intoxication symptoms, constricted pupils. Now જે in CNS stimulants, dilated pupils are there. Now in opioids, constricted pupil, bradypnea, central nervous system જે છે એને depress કરે છે or એને affect કરે છે. So because of that, જે respiratory rate જે છે, respiratory rate will be decreased. Bradypnea will be there. Drowsiness, hypotension, blood pressure is decreased, impaired memory and attention, psychomotor retardation, and slurred speech because of intoxication of opioids. Now, withdrawal symptoms includes tachycardia, heart rate will be increased, diaphoresis, excessive sweating, restlessness, dilated pupils, body ache, rhinorrhea, lacrimation, diarrhea and vomiting, and rhinorrhea જે પણ nasal discharges increase in rhinorrhea. Nasal discharges will be increased and lacrimation. So lacrimation in that lacrimal gland tears produce करશે. So lacrimation will be there. Excessive tears production by lacrimal gland. Diarrhea and vomiting, tremors, yawning, anxiety and irritability, and piloerection will be there. If withdrawal symptoms of opioid medications are includes tachycardia, diaphoresis, restlessness, dilated pupils, body ache, rhinorrhea, lacrimation, diarrhea and vomiting, tremors, yawning, anxiety and irritability, and piloerection. Overdose can produce respiratory depression, shock, coma, seizures, and death. Withdrawal assessment should be performed using an evidence-based tool such as the clinical opiate withdrawal scale. Overdose, opioid overdose can produce respiratory depression. The central nervous system છે તો એને generally affect કરે છે એટલા માટે respiratory depression will be there. So because of that, bradypnea જે છે present હોય છે, shock, coma or seizures, and death can be occurred. Withdrawal assessment જે છે, so withdrawal assessment should be performed using evidence-based tools. So for example, clinical opiate withdrawal scale. You can use this scale and assess withdrawal symptoms. Clinical judgment. Now એક સિનારિયો જે છે અહીંયા આપે છે. Recognize cues જે છે recognize કરવાના. How can you recognize cues, or you can identify what condition is present in patient? The nurse is monitoring a client in a psychiatric mental health facility. The client is receiving treatment for opioid addiction, and the nurse monitors for signs of withdrawal. The nurse recognizes cues associated with opioid withdrawal when the following assessment findings are noted. So generally, nurse જે છે એ પેશન્ટને or client જે છે એને સાયકેટ્રિક મેન્ટલ હેલ્થ ફેસિલિટીની અંદર મોનિટર કરે છે એન્ડ client જે છે client is receiving treatment for opioid addiction and withdrawal symptoms જે છે so એની સાઇન્સ કઈ કઈ છે એના cues recognize કરવાના છે. Tachycardia, diaphoresis, restlessness, dilated pupils, bones and joint aches, rhinorrhea, lacrimation, diarrhea and vomiting, tremors, yawning, anxiety or irritability, and piloerections are the signs of opioid withdrawal. So cues જે છે એ યાદ રાખો કે જે symptoms જે છે withdrawal symptoms opioid medication ના કે જેના પરથી આઈડેન્ટિફાઈ કરી શકે કે ઓકે ક્લાયન્ટ જે છે એ ઓપિયોઇડ મેડિકેશન જે છે એ લઈ રહ્યું હતું અને અબ્રપ્ટલી જ્યારે મેડિકેશન જે છે સ્ટોપ કરશે સો વિથડ્રોઅલ સિમ્ટમ્સ જે છે પ્રેઝન્ટ હશે. ઓપિયોઇડ ઓવરડોઝ ક્રાઇસિસ, એ ઓપિયોઇડ ઓવરડોઝ હશે કયા કયા ક્રાઇસિસ હશે. બોથ ધ યુનાઇટેડ સ્ટેટ્સ એન્ડ કેનેડા આર ફેસિંગ અ નેશનલ opioid overdose crisis that continues to have devastating impacts on person, family, and community. Risk factors for opioid use include, but are not limited to, opioid overdose crisis જે છે generally in both countries જે છે એ લોકો આ problem crisis જે છે ને face કરી રહ્યા છે. In United States and Canada also they are facing same problem. Now what are the risk factors for opioid use? History of opioid use disorder. Now opioid use disorder ની history હોય so maybe કોઈ એવો disorder હોય કે disorder ની અંદર opioid medication જે છે લેવી પડે. For example cancer patients હોય છે so for cancer patients in for pain we are giving opioid medication. So એવો જ same કોઈ disorder હોય કોઈ surgery perform થઈ હોય એ વખતે maybe opioid use કર્યો હોય. So history of opioid use disorder is one of the risk factor for opioid use. Previous opioid overdose or intoxication. Previously opioid overdose જે છે તે લીધો હોય or opioid medication જે છે કોઈ લીધી હોય અને overdose થઈ હોય intoxication થયું હોય. History of non-medical opioid use. Maybe some people use drugs as opioids as a drugs. So non-medical opioid use ની history હોય એ બી જે છે એની અંદર include કરવામાં આવે છે. High cumulative doses of opioids, multiple long and or short acting. High doses of opioids જે છે એનો use કર્યો હોય for multiple medications use કરે, long acting and short acting both medications they use. Prescribe respiratory depressing medications, for example benzodiazepines. Respiratory depression medications જે છે prescribe કરી હોય and એનો જે છે use વધારે કરતા હોય. Underlying respiratory conditions, for example asthma, emphysema, sleep apnea, COPD, cystic fibrosis, etc. Underlying respiratory conditions હોય and in that opioid જે છે use કરતા હોય તો એવી conditions ની અંદર બી risk factors જે છે present હશે. Known or suspected concurrent alcohol use. Maybe client જે છે એની અંદર known alcohol use હોય or concurrent alcohol use હોય કે continuous ની અંદર બી alcohol જે છે એ use કરતા એવું suspect થાય. Nurses and prescribers' role in verifying legitimacy and appropriateness of opioid medication. Now, what is our role or a nurse's role or prescriber's role in verifying legitimacy and appropriateness of opioid medication? Okay, why opioid medication is legal or legitimate in client or appropriate for the client? So first is an interprofessional approach among clients, nurses, prescribers, and pharmacists in monitoring appropriate use of opioid is needed and applicable state or federal regulations need to be followed. First what we will check that interprofessional approach among client, nurses and prescribers and pharmacists જે છે એ એની અંદર present હોવું જોઈએ. So એના use કરીને we can monitor appropriate use of opioids is needed or not. So છેલ્લા બી interprofessional approach હશે એમાં nurses, prescribers and pharmacists clients જે છે એ એકબીજાની સાથે communicate કરશે and એના બેસ પર જે છે એ લોકો identify કરશે કે opioid medication is needed for client or not and applicable for state or applicable according to state or federal regulation જે છે એ generally follow થવા જોઈએ. Nurses and prescribers needs to use checklist and screening tools such as the opioid risk tool and ensure other required documentation is in place and updated accordingly. Nurses and prescribers જે છે એમના માટે એક checklist હોય છે generally they build a checklist for opioid medication જે છે જેટલા બી ક્લાયન્ટ્સમાં યુઝ કરતા હોય છે so for them checklist જે છે એ પ્રિપેર કરવામાં આવે છે so they need to use checklist and screening tools. For example screening tools જે છે એમાં opioid risk tools જે છે they can use and using that tool we can ensure that required documentation is in place. ટૂલ્સ જે છે એનો યુઝ કરવો ચેકલિસ્ટ જે છે એનો યુઝ કરીને જેટલા બી રિક્વાયર્ડ ડોક્યુમેન્ટેશન જે છે એના પ્લેસ પર છે કે નહીં તમારે ચેક કરવાનું એન્ડ અપડેટ કરવાનું અકોર્ડિંગલી સો જેટલા બી ચેકલિસ્ટ છે એને અપડેટ કરતા રહેવાનું એન્ડ ટૂલ્સ જે છે જેનો યુઝ કરો છો એને અપડેટ કરતા રહો. કોમન રિક્વાયર્ડ ડોક્યુમેન્ટેશન includes a prescriber checklist, informed consent, medication agreement, prescriptions with all required elements. For example, diagnosis code, drug enforcement administration number, supply signature, two-step verification for electronic prescribing, and documentation of checking a prescription monitoring program. Now, આગળ જે કહ્યું કે required documents જે છે એના place પર હોવા જોઈએ. So what are the required document? Common required documentation includes prescriber checklist. Now checklist જે બી prescriber જે છે એમનું હોય છે એ checklist જે છે prepare કરવાનું. Then informed consent જે છે જેમાં આપણે generally જે પણ client જે છે એમની સાયન્સ લેતા હોય છે. So informed consent, medication agreement, પ્રિસ્ક્રિપ્શન વિથ ઓલ રિક્વાયર્ડ એલિમેન્ટ્સ જે છે એની અંદર એડ કરીને પ્રિસ્ક્રિપ્શન રેડી કરવામાં આવે છે. એન્ડ ડોક્યુમેન્ટેશન ઓફ ચેકિંગ અ પ્રિસ્ક્રિપ્શન મોનિટરિંગ પ્રોગ્રામ. હવે જેટલા બી છે એ જનરલ ઓર કોમન રિક્વાયર્ડ ડોક્યુમેન્ટેશન છે. Pharmacist role in verifying legitimacy and appropriateness of opioid medication. Now pharmacist જે છે એના કયા રોલ હશે? So role of pharmacist in verifying opioid medication legitimacy and appropriateness. When performing evaluation on whether an opioid medication prescription is appropriate, pharmacist must identify if the prescription has any red flag alerts. Now, Jeremy, whenever they are checking, a pharmacist checking that whether opioid medication prescription is appropriate or not. Firstly, prescription જે છે એને closely monitor or read કરવામાં આવે છે. એટલે pharmacist જે છે એમણે આઈડેન્ટિફાઈ કરવું પડે કે ઇફ પ્રિસ્ક્રિપ્શન જે છે એમાં કોઈ રેડ ફ્લેગ્સ છે કે નહીં, રેડ ફ્લેગ અલર્ટ્સ હોય, કોઈ પ્રોબ્લેમ હોય પ્રિસ્ક્રિપ્શન્સની અંદર, ડેટ એન્ડ ટાઈમ જે છે, સો ડેટ એન્ડ ટાઈમ વિલ બી there in prescription or signature, doctor's name જે છે એ બી ચેક કરવામાં આવે. Some examples are included below. However, it is not an exhaustive list and pharmacists can and will use their professional judgment and experience to identify if any potential issues exist. Now, some example is given. So on the basis of that, they can identify if prescription has any red flags or not. First is the prescription written in prescriber's usual course of practice? So GB course of practice means ke how prescriber always write their prescription in that manner. So a manner જે છે મેન્ટેન થયું છે કે નહીં પ્રિસ્ક્રિપ્શનની અંદર એ તમારે ચેક કરવાનું. Okay. Sorry, Janti. So prescription, whenever you use prescription, जब हम प्रिस्क्रिप्शन कहते हैं, सो जो डॉक्टर्स है उनका प्रिस्क्रिप्शन का कोर्स होता है अलग, कि वो जो नेम लिखते हैं उसके बाद डेट लिखते हैं, सिग्नेचर करते हैं, वो कोर्स ऑफ प्रैक्टिस है प्रिस्क्राइबर्स का. हम वो चेक करते हैं इन प्रिस्क्रिप्शन जो भी लिखा होता है. सो फॉर फार्मासिस्ट, इफ फार्मासिस्ट जो है वो चेक कर रहे होते हैं कि ओपियोइड मेडिकेशन का जो ऑर्डर दिया है और प्रिस्क्रिप्शन दिया है वो लीगल है या नहीं. सो उसे चेक करने के लिए क्वेश्चन जैसे क्वेश्चन वो लोग कुछ पूछते हैं और देखते हैं कि प्रिस्क्रिप्शन में कोई रेड फ्लैग्स है या नहीं, यानी कोई ऐसा पॉइंट है जिसे डाउट हो आपको कि प्रिस्क्रिप्शन जो है वो रॉन्ग है और कॉपी किए हुआ प्रिस्क्रिप्शन है. सो फर्स्टली वी विल चेक प्रिस्क्रिप्शन, जैसे प्रिस्क्रिप्शन जो लिखा है वो प्रिस्क्राइबर्स के यूजुअल कोर्स के मुताबिक है या नहीं, कि जो प्रिस्क्राइबर हमेशा के लिए लिखते हैं, ऑलवेज के लिए जो जैसा वो रिटर्न फॉर्म में लिखते हैं ऐसा है या नहीं, वो फर्स्टली चेक करते हैं फार्मासिस्ट जो होते हैं वो. Pharmacist must determine if the prescription is written outside the usual course of practice or specialty. So pharmacist जो होते हैं उनको पता होता है वो अपने जो भी डॉक्टर है उसने जो भी लिखा है प्रिस्क्रिप्शन जो भी लिखा गया है वो आउटसाइड द कोर्स है या नहीं, वो चेक करते हैं. इफ डाउट हो तो दूसरे जो प्रिस्क्रिप्शन है उसे उसके साथ कंपेयर करें, एंड देन आफ्टर इफ दे फाइंड दैट द written order or written prescription is out of the usual course, then they can complain or they can take actions further. Pharmacists must determine if there are unusual geographical distances between the client, pharmacy, and or prescriber that cannot be reasonably explained. Now, pharmacists जो होते हैं वो देखते हैं कि जो क्लाइंट है यानी पेशेंट है वो जहाँ पे रहते हैं और फार्मेसी जहाँ पे है और प्रिस्क्राइबर जहाँ पे वो तीनों जो है वो अलग दिशा में रहते हैं, बहुत दूर रहते हैं. फॉर एग्जाम्पल, if pharmacy is in if pharmacy is in Ahmedabad, and if pharmacy is very far from the client's home, and prescriber is also far from pharmacy and client's home, so they on the basis of that pharmacists जो होते हैं जो वो चेक करते हैं कि पेशेंट जो है वो कहाँ पे रहते हैं, फार्मेसी कहाँ कहाँ पे पेशेंट के घर से, और प्रिस्क्राइबर जो है वो कहाँ के है. इफ डिस्टेंस इज वेरी लॉन्ग, जियोग्राफिकली अनयूजुअल डिस्टेंस इफ यू फाइंड आउट इन प्रिस्क्रिप्शन, सो एंड विदाउट एनी रीजन, कि कोई रीजन वहाँ नहीं है, पेशेंट यहाँ पे है और फार्मेसी वहाँ पे है, एंड प्रिस्क्राइबर जैसे वो जो अलग रह रहे हैं, सो वो डिस्टेंस इफ यू कांट एक्सप्लेन रीजनेबली, then it shows that it is a red flag that patient or client is faking the prescription. So as a pharmacist, they have to identify if there is unusual geographical distance between client, pharmacy, and or prescriber, which cannot be explained reasonably. Does the prescription appear to be issued pursuant to a legitimate client or prescriber relationship and not issued by an online questionnaire website or similar entity? Now, प्रिस्क्रिप्शन जो लिखा गया है, सो वो लेजिटिमेट क्लाइंट के लिए है, और प्रिस्क्राइबर रिलेशनशिप क्या है वो चेक करते हैं, नॉट ऑनलाइन क्वेश्चनर वेबसाइट और सिमिलर एंटिटी का कॉपी किया है. वो जो है प्रिस्क्रिप्शन में हम देखते हैं, आर देयर थेराप्यूटिक डुप्लीकेशन ऑफ मल्टीपल लॉन्ग और एंड शॉर्ट एक्टिंग ओपियोइड्स. नाउ, थेराप्यूटिक डुप्लीकेशन मीन्स जो मेडिकेशन है, जनरली प्रिस्क्रिप्शन में कोई एक मेडिकेशन लिखी जाती है. फॉर एग्जांपल, इफ दे आर प्रिस्क्राइबिंग opioid medication, तो maybe the medication will be long acting opioid medication or maybe short acting opioid medication. But whenever you check prescription, you find that they are writing prescription, double prescription will be there. So therapeutic duplication will be there or not, you have to identify. So for long acting and short acting medication, therapeutic duplication जैसे identify करो ऊपर से. Now prescriptions, what will you check in prescription? Is there an unusual dosage, directions, or quantities beyond what is normally prescribed? Now, normally prescribed medication में जो डोज होता है, जो डायरेक्शंस होता है कि कैसे मेडिकेशन यूज करनी है, और क्वांटिटीज जो होती है उससे ज्यादा, और अनयूजुअल डोज हो और क्वांटिटीज जो ज्यादा हो, सो उस उससे आप उससे आप पता कर सकते हो कि मेडिकेशन जो लिखी गई है वो डॉक्टर और प्रिस्क्राइबर ने लिखी है और कोई अदर पर्सन जैसे जो है उन्होंने लिखी है. आर देयर डोज डायरेक्शंस दैट कॉन्फ्लिक्ट विथ अप्रूव लेबलिंग? देयर आर डोज डायरेक्शन, डोज और डायरेक्शंस होता है प्रिस्क्रिप्शन में. सो इफ देयर इज डोज और डायरेक्शन दे डजंट मैच विथ लेबल, और कॉन्फ्लिक्ट जो होता है if dose increase है और direction is different for taking medication, and label shows different dose and different directions, so if there is conflict between them, which that shows that prescription is fake. Are there frequent combinations from known drug cocktails such as benzodiazepines, opioids, and muscle relaxers? Frequent combinations for known drugs will be there in prescription. The cocktail we says, for example, in prescription benzodiazepine is written, opioids also they are taking, and muscle relaxers also taking. So did this makes cocktails. If you find out prescription which have cocktail medications of benzodiazepines, opioids, and muscle relaxers, it shows a red flag for prescription. Is there increased frequency of prescriptions for same or similar medications? Now, whatever the prescriptions, if you show prescription with increased frequency of medication or same or similar medications, now, for example, one patient is came to you 2 days ago and for prescription with same medication or similar type of medication. Then after next week same time patient will come to you for with same prescription for same medication or similar medication. So this shows that frequency is increased for prescriptions. प्रिस्क्रिप्शन जनरली जो लिखा गया होता है उसका टाइम जो है डॉक्टर प्रिस्क्राइबर है वो जो लिखते हैं उसकी फ्रीक्वेंसी मेंटेन की जाती है जिससे पेशेंट है उन्हें उनकी आदत ना लग जाए, एडिक्टेड ना हो जाए पेशेंट उसके लिए. नाउ when patients are using opioid as a drug, not as a medication, so they will come to you for frequently for medications or for refill. Does the physical appearance of hard copy prescription appear to be altered, forged, or contain grammatical errors? If physical appearance में changes हो, जो भी आपके पास hard copy है prescription की, if आपको ऐसा लगे कि उसे change किया गया है, if it is altered or forged or maybe grammatical error will be there, so it shows that the copy of prescription is fake. Does the prescription contain atypical abbreviations or medical shorthands? If if you are checking prescription, check there is atypical abbreviations. Now, typical abbreviations we use in common prescriptions. Prescribers use typical abbreviations. If there is atypical abbreviations or medical shorthands, it shows that the prescription is fake. Does the prescriptions have an unusual presentation, handwriting too legible, different color inks, multiple handwriting styles, etc.? Now prescription जो भी लिखा गया है वो unusual presentation में हो. For example, जो handwriting है वो different हो और different color की inks use की हुई हो. हैंडराइटिंग स्टाइल्स जो है वो चेंज होती हो, मल्टीपल हैंडराइटिंग स्टाइल्स जो यूज की गई हो, सो इट शोज दैट प्रिस्क्रिप्शन इज नॉट रियल. Is the prescription being presented for early refill without explanation and or pattern of early fills? तो प्रिस्क्रिप्शन जो भी लिखा गया है वो अर्ली रिफिल के लिए आए हो, वो मीन्स के पेशेंट को टाइम दिया गया है कि नेक्स्ट वीक आपका मेडिकेशन का रिफिल है. दे राइट मेडिकेशन फॉर on the basis of frequency. For example, if you give medication for this month, patient is provided date for next refill in next month. If without any follow up or schedule, patient जो है वो जल्दी आ जाता है अर्ली रिफिल के लिए without any explanation. So it shows that patient is taking opioid as a drug, or they are using opioid medication as a drug. Does the prescription show signs of being rejected by another pharmacist? And as a prescription जो लिखा है उसमें ऐसी कोई साइंस हो, इफ प्रिस्क्रिप्शन जो है उसमें ऐसा दिख रहा है कि दूसरे फार्मासिस्ट है उन्होंने इसे रिजेक्ट किया है, सो इफ ऐसा प्रिस्क्रिप्शन हो उसे हम यूज नहीं करते. क्लाइंट्स, नाउ what are the red flags in clients? Is the client consistently requesting early refills? if client जो है वो अर्ली रिफिल के लिए रिक्वेस्ट करते हैं, कॉन्स्टेंटली अर्ली रिफिल के लिए रिक्वेस्ट करते हैं. Is the client exhibiting drug seeking type behaviors, for example manipulative and or demanding behavior to obtain medications? इफ क्लाइंट जो जो क्लाइंट होते हैं, इफ वो ड्रग सीकिंग के लिए बिहेवियर शो कर दे, फॉर एग्जांपल मैनिपुलेशन स्टार्ट कर देते और डिमांडिंग बिहेवियर होती अर्ली रिफिल के लिए, और रिफिल मेडिकेशन जो है उसके रिफिल करवाने के लिए if they start demanding, so it indicates that client is taking opioid as a drug. Does the client travel long distances? That cannot be explained. Now client जैसे if client जैसे long distance में travel करते हैं, client is traveling in long distances without any explanation for medication refill, so it shows that client is taking drugs. Does the client's medication history show only controlled substance? Now, client medication history is जैसे if medication history is explaining that client is taking control substances, so history of medication is also checked to identify if client is taking drugs or not. Does the client request to pay by cash? For example, no third party billing in an effort to circumvent billing restrictions. Now, for taking medication or for buying medication, you have to pay medication and they give you bill. So to avoid these bill restrictions, client requests to pay by cash. Are there controlled substances prescriptions from many different prescribers and or using many different pharmacies? Now controlled substance prescription client session. So client's prescription shows many controlled substance prescription from different prescribers. For example, from one prescriber or from one PHCB, they take prescription for opioid. For another PHCB, they take prescription for benzodiazepines, and from another PHCB, they take prescriptions for muscle relaxants. So they use different prescribers for medications or controlled substance, or use different pharmacies. Does the client present intoxicated or under the influence of recreational drugs? Now client client जो आपके पास आता है, उन्हें देख के पता चलता है कि वो इंटॉक्सिकेटेड है, ड्रग्स उन्होंने पहले से ही लिया हुआ है, और रिक्रिएशनल ड्रग्स के इन्फ्लुएंस में है या नहीं, उससे पता चलता है clients are taking or drugs or not. Prescribers: is the prescriber unwilling to provide diagnosis, codes, and or letters of medical necessity for chronic opioid treatment? Now, for some prescribers, they are not going to provide you willingly a diagnosis code or letter of medication necessary for chronic opioid treatment. Is their prescriber unwilling to partner with pharmacy to provide necessary documentation? Now, prescribers जो होते हैं वो पार्टनरशिप करते हैं फार्मेसी के साथ कि जो भी डॉक्यूमेंटेशन जो भी है उनका फॉर ओपियोइड मेडिकेशन, you require some documentation and you have to collaborate with pharmacies. Now, if prescriber is unwilling to partner with pharmacy, this shows that prescriber is also using opioid medication for himself or herself, or they are providing medications illegally to others. Opioid antagonist: the pharmacy may proactively identify if an opioid antagonist may be beneficial for client on opioid medication. Now, opioid antagonists will work against the opioid opioid medication. So pharmacy identify कर से if opioid antagonist is beneficial for client on opioid medication or not. Many states have standing orders that allow pharmacists to dispense these prescription only medications to client or caregivers using their professional judgment. All healthcare providers should be aware of and or consider the use of these medications in client at risk for opioid overdose. Current available options: naloxone nasal spray. All healthcare providers जो जो भी healthcare providers है उन्हें ये अवेयरनेस होनी चाहिए कि जो भी ओपियोइड मेडिकेशन है, इफ ओपियोइड ओवरडोज विल बी देयर, what medications you can provide. So opioid antagonist or opioid overdose medication is available. Current option is naloxone nasal spray. Naloxone is antidote of opioid overdose. Hallucinogens include substances such as lysergic acid, diethylamide, LSD in short, mescaline, psilocybin, and phencyclidine. LSD, peyote, and mushrooms, and PCP are the hallucinogens, or they produce hallucinations in clients. What are the intoxication symptoms for hallucinogens? Agitation and belligerence, anxiety, miser or violent behavior, blank stare, diaphoresis, elevated vital signs, hallucinations, incoordination, muscular rigidity, and chronic jerking, paranoid and tremors and seizures. So because of intoxication effect of hallucinogens, restlessness will be there. The client will feel anxious, abnormal behavior or violent behavior will be there. Blank stare, diaphoresis, excessive sweating, vital signs will be elevated, hallucinations, incoordination, muscle rigidity or muscular rigidity, and chronic jerking. Jerky movement will be there of muscles or hands, extremities. Paranoid tremors and seizures will be there. Now, for withdrawal symptoms, if hallucinogens, if you abruptly stop taking medications or hallucinogens, it will cause withdrawal symptoms, irritability and agitation, anxiety, mood changes, headache, insomnia, and difficulty in concentrating. If an overdose of these substances occur, serious health problems can result. Overdose effects of LSD, peyote, and psilocybin include psychosis, brain damage, and death. Overdose effects of PCP include psychosis, hypertensive crisis, hyperthermia, सीजर्स एंड रेस्पिरेटरी अरेस्ट. इफ ओवरडोज होता है, जो भी हेल्यूसिनोजेंस लेते हैं, इफ उसका ओवरडोज हो गया, फॉर एग्जांपल इफ एलएसडी का ओवरडोज है और मशरूम्स का और पियर्ड का ओवरडोज है, सो ओवरडोज इफेक्ट विल बी देयर. नो सायकोसिस जसे ओवरडोज इफेक्ट्सની અંદર જે પ્રેઝન્ટ હશે, or brain damage and death are the effects of overdose. If PCP overdose will be there, so it will cause psychosis, hypertensive crisis, hypothermia, seizures, and respiratory arrest. Treatment. Treatment involves low environmental stimuli, speak slowly, clearly, and in low voice, and medications to treat anxiety. Now, for treatment of overdose, ट्रीटमेंट जो होती है उसमें हम जो भी इन्वायरमेंटल स्टिमुलाइज होते हैं उसे लो कर देते हैं. फॉर एग्जांपल स्लोली स्लोली बोलना और धीरे से बोलना, क्लियरली बोलना, एंड इन लो वॉइस यू हैव टू स्पीक. Medications we can use to treat anxiety. Treatment of PCP overdose involves possible gastric lavage if alert, treatment to acidify the urine to assist in excreting the drug, and interventions to treat behavioral disturbances, hyperthermia, hypertension, and respiratory distress. If PCP overdose होता है तो उसके लिए if client is alert, you can use gastric lavage, and for treatment to acidify the urine, you can use excreting the drugs. जो ड्रग्स होती है, इफ एक्सक्रीडिंग ड्रग्स यू गिव, वो ड्रग्स की वजह से जो भी पीसीपी है वो यूरिन के थ्रू एलिमिनेट होता है, and you can also acidify the urine. Interventions to treat behavioral disturbances will be taken in treatment. हाइपरथर्मिया, हाइपरटेंशन एंड रेस्पिरेटरी डिस्ट्रेस के लिए ट्रीटमेंट दिया जाता है. मैनेजमेंट ऑफ विड्रॉल is primarily supportive and may include medications to target particular problem behaviors such as agitation. For withdrawal symptoms or management of withdrawal, primarily supportive therapy or care दी जाती है, और medication में भी we can include in treatment. For behavioral problem such as agitation, if restlessness will be there in client, to manage the symptoms, we can use medications. Flashbacks, which are unexpected re-experiences of the effects of hallucinogenic drug, can occur for extended period of time after the drug's original use. Safety during flashbacks is a priority. Now, whenever we take hallucinogens, so effect of hallucinating drugs that create hallucinations. So flashbacks flashbacks will be there. Hallucinations जो होता है उनके flashbacks वहाँ पे होते हैं. Maybe they are unexpected and re-experience of they create re-experience of drugs. So they can run for longer time. So period for flashbacks will be extended after the use of original drugs. Safety should be maintained and safety during flashbacks is priority. जो भी ड्रग लेते हैं वो ड्रग्स जो होता है उनका असर खत्म होने के बाद भी कई टाइम कुछ समय तक ड्रग्स का जो है फ्लैशबैक्स आता है. ड्रग्स के यूज का और इफेक्ट जो है उनका फ्लैशबैक्स होता है. सो वो लॉन्ग टाइम के लिए चल सकता है. सो ड्यूरिंग दैट फ्लैशबैक्स द सेफ्टी इज द मेन प्रायोरिटी. Inhalants include gases or liquids such as butane, paint thinner, paint and wax removers, airplane glue, nail polish remover, and nitrous oxide. Inhalants are the substance or liquid or gases we use or we get addicted of that. For example, butane, paint thinner. समटाइम्स ऐसा होता है कि पेंट जो लगाते हैं और पेंट की स्मेल हमें बहुत अच्छी लगती है, और वैक्स रिमूवर्स होता है उनकी स्मेल अच्छी लगती है. नेल पॉलिश रिमूवल की स्मेल अच्छी लगती है और उससे कई बार एडिक्ट हो जाते हैं. सो इनहेलेंट्स आर द गैसेस और लिक्विड्स. फॉर एग्जांपल ब्यूटेन, पेंट थिनर, पेंट एंड वैक्स रिमूवर्स, एयरप्लेन ग्लू, nail polish remover, and nitrous oxide. Intoxication and withdrawal. So intoxication symptoms for inhalants are enhancement of sexual pleasure, euphoria, excitation followed by drowsiness, disinhibition and agitation, and delirium and psychosis is intoxication symptoms of inhalants. Now, withdrawal symptoms of inhalants: irritability and agitation. Client will be irritable and agitated. Anxiety, mood changes, headache, insomnia, difficulty in concentrating are the withdrawal symptoms for inhalants. Overdose can cause damage to the nervous system and death. Overdose of inhalants can cause damage to nervous system. They can affect your nervous system and they can also lead to death. Management of withdrawal is mainly supportive and including the treatment of affected body symptoms. Now, management for withdrawal symptoms. Firstly, supportive treatment we are providing, and then after treatment we are giving in treatment जो भी affected body symptoms है और systems है उनके बेस पर हम ट्रीटमेंट प्रोवाइड करते हैं. Marijuana, cannabis sativa, generally smoke but can be ingested. It can be legally prescribed in certain states, and in some states and province it is legal without a prescription. So generally जो भी cannabis होता है वो स्मोक फॉर्म में यूज करते हैं और मे बी You can take in through ingestion, but legally in some state they can prescribe legally cannabis, and in some states and provinces they are not legal. Intoxication effect can leads to heightened sensation. Sensation will over sensation or hypersensitivity will be there. Depersonalization, red eyes, increased appetite, dry mouth, and tachycardia. Now, withdrawal symptoms: patient will become irritable and agitation will be there. Anxiety, mood changes, disturbing dreams, and headache are the withdrawal symptoms of for marijuana or cannabis. Long-term dependence can result in lethargy, amotivation syndrome, difficulty concentrating, memory loss, and possibly chronic respiratory disorder. Withdrawal management is mainly supportive. So, long-term dependence of marijuana or cannabis can result in lethargy. Client will feel tired, amotivation syndrome, and difficulty in concentrating. जो भी concentration power होती है वो decrease हो जाती है. Memory loss will be there because of long-term dependence, and possibly chronic respiratory disorders will be there if you by take cannabis by smoke or inhalation. So it can cause respiratory disorders also. Withdrawal management for cannabis is mainly supportive. Okay, we will stop here. Any doubt, any question for Jayanti? I will try to speak in Hindi and English.
Okay, ma'am, no problem.
બીજા બધાને કોઈ પ્રોબ્લેમ?
No,
કોઈ
ma'am.
ક્વેશ્ચન?
Uh,
ઓકે, કિંજલ એન્ડ વર્ષા.
No problem.
નો પ્રોબ્લેમ.
Mhm.
બંનેને ગુજરાતી ફાવે.
હા,
ક્યારે જોઈન કર્યું કિંજલ અને વર્ષા?
મેં 7 વાગે જ કર્યું. CNS. ઓપિયોઇડ્સ થી.
એટલે એમ નહીં, ક્લાસ જે છે ક્યારથી જોઈન?
આજથી જ છે મારે.
આજથી જ છે એવું છે
હમ.
કે વેલકમ ક્લાસમાં તો પછી.
થેન્ક યુ.
અને વર્ષા ઓકે.
Okay, I'm leaving.
ઓકે, થેન્ક
Have
યુ.
a nice evening, everyone.
હમ.
Kale Maria.
ઓકે.
ઓકે, થેન્ક યુ.
Thank you.
If you have no doubt, no question, you can leave the meeting. Thank you.
thank you, ma'am.
Thank you, ma'am.
Okay.